Depression is one of the most common mental health disorders and remains a leading cause of disability around the world. In the United States alone, nearly 1 out of every 10 adults experiences depression. Despite how widespread it is, many people still misunderstand what depression actually is. A common misconception is confusing depression with ordinary sadness. Everyone experiences sadness at some point. A disappointing exam, losing a job, an argument with someone close, or even a gloomy day can affect your mood. Sometimes, sadness appears for no clear reason at all. Fortunately, these feelings usually fade as circumstances improve. Clinical depression is very different. It is not simply a temporary emotional state. It is a medical condition that affects the brain and can last for weeks, months, or even longer without proper treatment. Unlike everyday sadness, depression can make it difficult to work, enjoy hobbies, maintain relationships, or even complete simple daily tasks. The symptoms vary from person to person. Many people experience a persistent low mood, lose interest in activities they once enjoyed, notice changes in appetite, or struggle with feelings of guilt and worthlessness. Others may sleep far more, or far less, than usual, have trouble concentrating, feel constantly exhausted, or think about death and suicide. Mental health professionals typically diagnose depression when several of these symptoms continue for at least 2 weeks. Depression is not only an emotional illness, it also affects the brain physically. Brain imaging studies have found structural changes in certain regions, including the frontal lobes and the hippocampus. Researchers have also observed disruptions in important brain chemicals such as serotonin, dopamine, and norepinephrine. In addition, depression may interfere with normal sleep cycles, the body's internal clock, and hormone regulation, including cortisol and thyroid hormones. Even with decades of research, scientists still do not fully understand why depression develops. Current evidence suggests that it results from a combination of genetic factors and life experiences. At the moment, there is no medical test that can accurately predict who will develop depression or when it will occur. One of the greatest challenges is that depression is often invisible. Someone may appear perfectly healthy while silently struggling every day. Because of this, many people wait years before asking for professional help. Fortunately, effective treatments are available. Medication, psychotherapy, or a combination of both can significantly improve symptoms. For severe cases, treatments such as electroconvulsive therapy may be recommended, while newer approaches like transcranial magnetic stimulation continue to show promising results. If someone you know is living with depression, offering support can make a real difference. Encourage them to seek professional help, offer assistance with finding a therapist, or simply listen without judgment. Small acts of support can feel enormous to someone battling depression. Most importantly, remember that depression is not a sign of weakness. It is a medical condition, just like asthma or diabetes. No one can simply choose to recover through willpower alone. Talking openly about mental health also matters. Research suggests that honest conversations, even about difficult topics like suicidal thoughts, can reduce stigma and encourage people to seek the help they need. As more people receive treatment, researchers continue to deepen our understanding of depression and develop even more effective therapies for the future.